Hey YouTube, what's going on? This video was gonna be on a very common situation that comes up in nursing period, but I'm only really referring to long-term care, although it probably does apply to the hospital as well. But I just never worked in a hospital, so I don't speak on hospital nursing at all. But first, if you're new to this channel, my name is Lauren Ringgold. I am an RN, and this channel is basically about long-term care, nursing, and nursing school. I have a couple videos on nursing school and clinical and stuff, so you can check that out. Like I was saying earlier, this video is about a common situation, and this situation school doesn't really teach you about. This is more state regulations, I'm gonna tell you, because if your job doesn't tell you in orientation, or your DON and unit manager like let this slide, you could go without knowing this information. Okay, the situation is, it sounds so simple, right? But there's kind of a lot to it when you look at it from a state surveyor's point of view. Because what a state surveyor might do is come in, look at your 24-hour report, and see what are the nurses saying when they give out pain meds, and what is the process here when y'all give out pain meds. Because they're looking for non-pharm interventions, the reason for the pain meds, interventions you did, whether you told the doctor if it was necessary. They're just making sure that documentation is in place, making sure the pain level matches the type of pain med given. When a patient complains of pain meds, step one is not to medicate the pain. As nurses, we always want to see if we can fix the problem without throwing a medication at it, because medications have side effects. Medications can cover up a problem, needs to be fixed. That's why we have non-pharm interventions. So if there's a complaint of pain, the state is going to be looking for what non-pharm interventions did you attempt. So there's a lot of non-pharm interventions. There's like ice, repositioning, distraction. Like those are the only couple that I can think of right now, but that's an example of non-pharm interventions. Let's say that somebody complains of ankle pain and they walk up to you and tell you. So that's where your assessment starts. Like, what did you see the patient doing the whole shift, if you can remember? And then the fact that they walked up to you, that needs to go on a note, because if they can put weight on that ankle, that's worth putting in your note. Then you could make sure you eyeball that ankle real quick. Is it all bruised up? Is it swollen? What's going on? Some patients, they might be manic, or just one of those patients that are very busy, back and forth activities, going back and forth to the bathroom. I used to have a patient like that at my old job, and she would just be back and forth, back and forth, back and forth, back and forth, and she was a little overweight. So she would be complaining of pain, and we would give her some ice, tell her to sit down, put it up, and then she would just go on about her business. In that case, you can document non-pharm intervention, effective, patient ambulating, patient putting weight on the ankle, no bruising, no swelling, non-pharm interventions effective. Bam, that's your note. That's basically non-pharm in a nutshell. And in that situation, that's awesome, because you fixed the problem. That patient needed to slow down, take a rest, put her leg up for like an hour, put some ice on it, and then she was able to, get back on track as far as feeling better. So that's, you actually fixed the problem. Some patients are complaining of pain, and you take them to the activities, they have all this social interaction, they're not just sitting in their room, and it fixes the problem. Pain could be psychological, related to like mental health or boredom, everything's magnified when you're just sitting there bored. Some patients will refuse non-pharm interventions, and then in that case, some patients will refuse an assessment as well. Some patients only want their oxy, or they know non-pharm interventions are only going to do a tiny bit, so they just refuse it and they just say, nope, I want my oxy, and you document that. You say non-pharm interventions refused, assessment refused, or non-pharm interventions refused, and then you say your assessment. Sometimes they'll let you look at it, but they don't want non-pharm interventions. So all that has to go in your note, and then you go to pain meds. Now, that note can go under the pain med. You don't have to do double documentation. Just put it under the Tylenol, or put it under your oxy administration, because when you go to sign out the pain med in Point Click Care, anyway, I don't know about other systems, but it makes you do a note. I see a lot of nurses just signing out pain meds and not saying nothing. And if the state sees that, if they want to, they're gonna get that facility for that. And then it might not directly affect you as the nurse, but now the state has to come out again. And also, if something goes to court, you want your documentation to be covering your butt, okay? Like any pain, you rule out the worst case scenario. Somebody says, my back hurts, you do your best to rule out a UTI. Ask if they're having symptoms of a UTI, because back pain could be kidney pain. Another example is leg pain could be a clot. So you have to make sure that this is chronic pain and it's not new pain, because if it's new pain and it's in the leg, it could be a clot. Alright, so you have to rule out that worst case scenario with your pain, because if a patient complains of some pain and it's the beginning of your shift, you don't know what that patient was doing before you came in. A patient will fall or something, it won't be written up, like it'll be unwitnessed, or the nurse just doesn't write it up. And then you come along and you're actually witnessing the injury that is from the fall. So when somebody's telling you they're in pain, especially if you're agency or you're a new nurse to that patient, that you make sure you check that pain out. And don't take it lightly, because pain could be something bigger. And also about non-pharm interventions, it's just bad practice to jump right to medication. So make sure you're putting on the medical record like your non-pharm interventions. So the next part of giving pain meds is the level and the type of med. So a pain level 1 to 6 is like mild to moderate. So 1 to 6 gets Tylenol. You could ask your nurse educator or your unit manager or your DON or somebody who knows the actual state regulation, because I'm pretty sure up to a 6 you can give Tylenol. So if they say a pain level of 8 and you're giving Tylenol, well, on paper it looks like you're under medicating them and the patient is suffering. So you have to justify if they're refusing Tylenol and they want oxy, and they're only having a 6 out of 10 of pain. You have to justify giving oxy. You can't just say, oh, 6 out of 10 and I gave oxy, because now you're over medicating. And that oxy has side effects. You can't do too much and you can't do too little. So 1 to 6 is Tylenol. Above 6 is narcotics, or like tramadol. You know what I mean? In Point Click Care, it makes you document a pain scale. But if the patient is nonverbal and just cognitively not able to rate their pain, you have to do that other pain scale on Point Click Care. It's called a pain AD, PAINAD scale. And it asks questions like, are they tense? Do they need to be consoled? Are their respirations rapid? Like, are they moaning? Are they guarding? It asks you all them questions, and then it comes up with a level of pain, and it's for those people that just can't tell you. I hope it was nice and clear for you guys. Just make sure you're documenting your non-pharm interventions, your assessment, and that's it, guys. I'll talk to you soon. Bye.